So now what we're doing is we're looking at the sphenoid bone from the inferior view of the skull. And the sphenoid bone can be seen on either side of our nasal passageway here. And so these processes we're seeing right here, they look like elevations, reminded them of wings. And so they got their name pterygoid because it's a reference to wing, as in pterodactyl. And then the P is silent in that word when you look at how it's spelled. And so what we do is we name this ridge right next to the nose the medial pterygoid, and we name this outer ridge that's lateral to that the lateral pterygoid. Once we found our pterygoids here, then we can actually rotate the skull, and then lateral to them and posterior to them, we're actually going to see a hole that's oval-shaped, which is our foramen ovale. So what I'm going to do is I'm going to pass the pipe cleaner again through that hole that we were just looking at so that you can actually see it. And as you'll see from the inferior view, we can see it right here. And as we rotate the skull around, then you can see the pipe cleaner going through a hole here. And if you look closely on the other side, you can see this oval hole, which is our foramen ovale. Now we have one more structure associated with our sphenoid bone that you're responsible for. So now what we're going to do is we're going to rotate the skull around so that you're looking at the foramen ovale from this side again, and near it, pointing toward the face that the pointer is in now, is a small round hole, which is the foramen rotundum. So if something's rotundum, it's round like the rotundum of a Capitol building. So again, this is the foramen rotundum that we're seeing. From the sphenoid bone, what we're going to do is we're going to look at the ethmoid bone. So remember, our ethmoid bone is this yellow bone that we can see midline. And then as we rotate the skull, we can see the ethmoid bone in the orbit, and we can see the ethmoid bone in the upper part of the nose. So as we look at the midline portion between the eyes, there's actually a ridge of bone midline that we can see right here, which is referred to as the crista galli. And then either side of this ridge, there's a flattened area that has little tiny holes in it. And so these two flattened areas are referred to as the horizontal or cribiform plates of the ethmoid bone. Now, the other portion of the ethmoid bone that we can see is that if we rotate the skull around, then as we look in this colored skull, we can see midline there's a yellow ridge coming down from the top of the nose, and that's the perpendicular plate of the ethmoid, and it helps form the septum between the nose. So as we look at this real skull, then this bone that we're seeing clear up high here is the perpendicular plate of the ethmoid, separating the nose into two sides. Now, the ethmoid bone, as we saw, sits up here, and then it rotates downward. And so we can see the ethmoid bone in the orbit of the eye, and we can see it in the upper lining of the nose. So this piece of bone that we see in the orbit of the eye and the upper nose is called the lateral mass of the ethmoid bone. And that's the part that's hollow that would have our ethmoid sinus in it. And if you look in the nose, we actually have folds in our nose. This big fold is called the inferior turbinate. The next fold up, which is pretty hard to see in this skull, but it's sitting right here, is the middle turbinate. And in most skulls, the superior turbinate is very hard to find. So what one can see is the middle turbinate, which is part of the ethmoid bone, and then the lower turbinate, which belongs to a different bone when we look at the skull. So another way to see the folds we were just referring to in the nose is to look at a model that's been cut mid-sagittally. And what you'll notice is there's a fold here in the nose, a fold here in the nose, and a lower fold in the nose. So this is the superior turbinate, this is the middle turbinate, and this is the inferior turbinate that we were just looking at in the skull. And as you see, it's a folding pattern that increases surface area in our nose, largely for olfactory, our ability to smell. So the mandible is a bone that forms our lower jaw. So what we can do at the mandible is the major portion of the bone that we see here is called the body. And then notice the bone is on this plane, and then it turns and rotates upward like that. So the point where it turns right here is called the angle of the mandible, which you can feel just in front of your ear. And then this really flat bone that we see as part of the mandible is the ramus of the mandible. So when we're looking at the mandible, body, angle, and ramus. So if I get a disarticulated jaw that we can see, then again what we're just looking at is the body, the angle, and the ramus. So on the ramus of the mandible, we have several things that we want to look at. So this real rounded portion that's at the top of the mandible is the mandibular head or mandibular condyle. And both are used interchangeably because it's a smooth surface for articulation. So if this is a head, then the narrowed part of the bone here would be a neck. Now, the other point on the ramus right here is called the coronoid process. And then when we look at the head of the mandible and the coronoid process, we see that there's a depression in the mandible right here that we call the mandibular notch. Now, the mandible has to get blood and nerve supply into and out of it. So when we look at the outer body of the mandible, we have a hole that's open, which is called the mental foramen. And a nerve passes through that called the mental nerve that they use to deaden you when you're having lower oral surgery, which is why your lip goes dead, your tongue goes dead on that side. Now, if we rotate it so that you can actually see the inside of the ramus, then we also have a large opening here, and this opening here that the pointer is passing in is the mandibular foramen. So the mandibular foramen is on the inside of the ramus, and the mental foramen is on the outside of the body. Now, the mandible interacts with the maxilla to form your upper jaw and your lower jaw. So on both the mandible and on the maxilla, we have ridges associated with the socket in which the tooth sits in the jaw itself. So the socket created in the jaw for the tooth is called an alveolar process. And we can actually see that they have ridges associated with them in terms of where each of the roots fit. Now, in this skull, the alveolar processes have worn away, and so we can actually see how the tooth root fits down into this socket in the bone, which is what we call an alveolar process that we're seeing. So you can see how the tooth fits into these alveolar processes. So when we're looking at our maxilla, besides our alveolar process, then what we want to do is we want to rotate it so that we can see it internally. It's going to work better on this skull. So if I rotate it so I can see the anterior aspect of the hard palate, then this is the Palatine process of the maxilla that we're seeing here. And then as you look, your two front teeth are called incisors. And then posterior to the incisor, there's a hole that we can find in the maxilla. And this hole is called the incisive foramen that we find in the maxilla between those two teeth. As we rotate the skull so that we're looking at the maxilla again from the front, notice that inferior to the eye, we actually have a foramen that enters the bone. And so a word we'd use to describe inferior is infra. And then what's it inferior to the orbit of the eye? So this is the infraorbital foramen that we're seeing. Now, as we look at the maxilla, it comes up the side of the nose, and we can see it on the inside of the skull here. Unfortunately, it's broken out on this skull. So as we look at this skull, then here's the maxilla going upward, forming the anterior aspect of the orbit of the eye. And notice that there's a little groove sitting right in here. So this little tiny groove is called the lacrimal groove. And at the bottom, we'll eventually learn there's a hole called the lacrimal foramen. Now, in some people, this lacrimal groove is actually in the maxilla. In other people, it's in a little tiny bone that forms the front of the eye here, which we call the lacrimal bone. So if you look for suture planes, you'll be able to see that we have this little tiny skull bone sitting there. And it might be easier if you looked at this colored skull first and notice that on the colored skull we have this bone that's a different color right there, which would be our lacrimal bones. Now the other bone that we could look at is that in the roof of our mouth we have our palatine processes of our maxilla. Then we have these two pink bones that are the most posterior, which are called the palatine bones proper. So when we're looking at a regular skull, what we want to do is we want to turn it upside down like this. We'll notice there's suture planes right here that we can actually see. And then this bone posterior to those suture planes are the palatine bones proper. And the palatine bones actually rotate and go upward along the orbit of the eye, and they support this really big fold that's at the bottom of the nose, which is the inferior nasal concha. And then we have two little bones that are going to form the bridge of our nose right here, which are our nasal bones. Now, as we go from our maxillary bone laterally, we have a bone right here that forms the high point in our cheek, which is called the zygomatic bone. And then the zygomatic bone has this extension off of it right here that points toward the temporal bone. So this is called the temporal process of the zygomatic bone. And they form this arch. So as a review, the arch is formed by the zygomatic process of the temporal bone and the temporal process of the zygomatic bone, forming what we call the zygomatic arch. Our last bone we're going to look at is a bone that forms the posterior septum of the nose. So it's partially fractured in this skull, but this bone right here that would have been complete and formed the back of the septum of the nose is our vomer. And so the vomer creates the posterior aspect of the septum, and if we rotate it around, then the front of the septum here is the perpendicular plate of the ethmoid. The bottom part of the bone right here is the vomer that we're seeing, anterior. That completes our discussion of the skull. So one of the unique characteristics of the skull is we have three little bones that are part of our vibrational pathway for hearing. So they're called auditory ossicles. And the three little bones are embedded in plastic here. And the lateralmost one, or the outsidemost one, is the malleus. The one in the middle is the incus, and then the innermost one would be the stapes. Now, if we were looking for these three little bones, our landmark would be that we would find our external auditory meatus. Then once we found our external auditory meatus, we'd rotate to the skull to the inside. And you can see we have this big ridge here on the petrous portion of our temporal bone. And the little bones exist right in this swollen area right here. And they're involved in, again, transferring vibrations to the inner ear for hearing it. So when they're collected, we have to cut this bone, break this bone out carefully, and then pull those bones out. Usually you have to do it with a fresh skull before it's dried to save the bones.